Good afternoon, good morning, good evening, whenever you get a chance to listen and look. This is about being locked down in a foreign country under this COVID-19 virus. I'm in Malaysia, uh, pretty much stuck. Um, was planning on, I left Ghana, went to Thailand, stayed for a month, and came here, and was planning on being here probably till April or May, and then back in the U.S. But because of the outbreak of this global pandemic, I may be here indefinitely. And so I just want to share what it's like being in Malaysia, being in a foreign country, this one particularly during this worldwide pandemic. When I got here, things weren't as bad. I've been here a little less than 2 weeks. But right after I got here, the news started speaking of how it was spreading. Italy, harder hit than anywhere outside of China. Death Mountain in a frightening way. Spain, France, even the UK. And so I thought maybe I'll leave here earlier than expected. Maybe I'll leave next month. Maybe I start making plans. Uh, maybe even the end of March. But I wasn't sure really. I just trying to watch this thing day by day and figure out the best move. I thought I could get stuck here really if I didn't move pretty quick. And then didn't move too fast, and I saw Trump put the travel ban down from Europe, and naturally hordes of Americans living and working and whatever they're doing overseas, trying to get home at this time. Everybody feels safer at home in a crisis. And I saw the images at O'Hara, JFK, Dallas Fort Worth, thousands of people jammed together in line trying to get through customs. The World Health Organization, the CDC, and other reputable health agencies have said social distancing is one of the main ways to keep from getting this thing and to slow the spread. I saw the governor of Illinois responding to the lack of federal government guidelines, policy, direction, and support. He said there should have been many more customs agents, security personnel at these airports to lessen these lines and this crowd. There's probably no way around it, to be honest, what's taking place in terms of the panic and the crowds. But that was the last place I wanted to be, stuck in line shoulder to shoulder for 2 and 3 hours trying to get through customs. So I'm glad I didn't try to get back home in a panic. That being said, there were only a few cases here when I got here, maybe 30, maybe 40, I don't know, it wasn't a lot. Nobody's dead when I got here. They had an Islamic conference here that brought in participants from the neighboring countries. Thousands, I don't know how many thousands, but there were several thousands at a mosque. Some of them were exposed and infected with the COVID-19 virus. Shouldn't have had a big gathering, but they did. People not listening, paying attention, even though this has been a serious thing since January in China. And guidelines have been coming out from the World Health Organization for a while, but not everybody's paying attention initially, including up to this point. So after that, there was a spike in cases in Malaysia. It went from maybe 40 to 60 or 70, then next day is maybe 80 or 90, then it's over 100. When it got over 100, the government started looking real close. They realized that at this conference, there were people from a lot of different places, and that some had the virus in their system, and now there's a spread, there's an outbreak. So they did the responsible thing, and what the CDC and the World Health Organization, tracing, isolation, hospitalization, whatever's necessary, whoever's been in contact with who, we're trying to follow this up. They did that for a day or two, and they realized quickly the cases spiked to 400. And they realized that just contact tracing is not going to be enough to contain this virus in Malaysia. So the government came out Tuesday and said there's going to be a nationwide lockdown starting Wednesday, starting midnight Tuesday actually. Nationwide lockdown. Only thing will be open are pharmacies, banks, hospitals, and takeout food places. Um, Grocery stores will be open. Everything else closed. Stay at home. So like in most big cities in the world, a lot of people are not from there. So a lot of people were making their way out of Kuala Lumpur Tuesday and even going into Wednesday under the lockdown because they want to be home around family and friends, and I can understand the safety, feel safer and more secure. So we under lockdown. But my personal situation is this: where I'm at, right down below me in the building, there's a 99 cents mark, like 7-Eleven, Quick Trip, Super America, places like that in America. But they have more food in these places here. Indomie, they call it in Ghana. I forgot what we call it in America. Romaine noodles, we call it in America. A lot of noodles, packaged goods, tuna fish, sardines, stuff like that. Pastas. They have some microwave stuff. They got some frozen food stuff. And they have a lot of snacks and other kind of stuff. So you're not going to starve. My only concern and main concern when I heard there's going to be a lockdown, I have to be able to get something to eat. I don't know anybody here. I'm on my own. So the main thing for me was food. So that's a problem. It's not a problem. I can walk out the door of the building and in 3 minutes be at Subway. They're open every day from 10 in the morning to 8 at night. So I can go Subway every day. I can eat. If I go the other direction, there's an Indian restaurant. Sit down. I haven't eaten there yet. Sit down restaurant. They're not open for sit down, but they're open for carry out. So there's food. Down from there, there's another convenience store, Indian store, sells snacks and all kind of stuff, drinks. So there's plenty here for me to survive on and everybody else in this area. I just walked across the street today. There's a market. They had fresh potatoes. I love potatoes and onions, so I got potatoes. The market down below me has eggs, fresh eggs. Tuesday, I went to Aeon, A-E-O-N, I think it's spelled, grocery store, and I stood in line for 40 minutes getting the things that I needed. Peanut butter and jelly bread, a few other food items, snacks and stuff. It carried me a few days until I could figure it out. The line was 40 minutes long. Nobody panicking, nobody frustrated, nobody stressed out. It didn't seem like it anyway. Nobody upset, mad, angry, none of that. People just patiently waiting to pay for their stuff and go. I like that. So most of them had masks on, and I didn't think to put mine on until I'd been there for a while. I wear my mask when I'm on the train here and sometimes on the buses. But generally speaking, I don't wear it. But if I'm in crowded places, I do. And I put it on in that grocery store once it hit me that I should have it on. Okay, so that went well. The thing is, when I think about it, I'm glad I'm here. I feel safer here, and I feel like the outcome would be better here than it is in America. I'm glad I'm here. I ain't trying to come home, and I don't think I'm gonna try to come home until this thing is just about over and run its course. I may not come at all. I may just stay here, because in America they're so far behind the curve when it comes to testing. The World Health Organization, the head of it, has said that not testing, massive testing of the population is like driving blindly through this pandemic. And because of the policies of the American government headed by who, initially they were only allowing tests to be done by the CDC. Then come to find out their tests weren't accurate, weren't proper, weren't good enough. They weren't allowing the World Health Organization testing kits to be used, even though every other nation in the world were using the World Health Organization testing protocol, kits, procedures. America, no, we only want America first, I guess. So way behind with testing still. South Korea tests more in one day than America has tested since this whole outbreak began, which is shameful, irresponsible, incompetent. And now the governor of Ohio said days ago, even though there's only 6 or 7 known cases in Ohio, there are probably 100,000 that have been exposed to it. There's a website. I don't have it right now. Maybe I can pull it up on this other phone. That you can go to, that a 17-year-old kid came up with. It was on Democracy Now! So if you know about Democracy Now!, you can go to Democracy Now! Amy Goodman interviewed this guy. He's 17 years old, and he came up with a website where you can track minute by minute the number of cases globally and the number of cases in your country. I know I'm touching my face, but it's okay. I just wash my hands. Coming from outside shopping, I wash my hands good. So you don't know how hard it is to stop touching your face till they tell you not to. So nothing in my mouth or my nose, but I keep my hands clean because I take this thing serious. So the website, when I looked at it yesterday, globally there were about 200,000 known infections, and there were about 8,000 fatalities, death. That's a 4% mortality rate. 4%. For people who think this is just like the flu, some of them are still drinking the Kool-Aid, and they think they know more than everybody else, and they think there's nothing to be worried about. It's just the flu. I thought the same thing, but I'm a reader. I take the time to read entire articles, books, magazines, not just looking at YouTube videos, not just going on what I think, but trying to do serious investigation with stuff that interests me. We all should. You should teach kids to read from the time they're 4 and 5 years old. You should read to them and inculcate that habit in them and a love for books and knowledge, because just going on what you know ain't enough. You need to read in life. So me taking the time to read these articles that come out every day, New York Times, different newspapers, Washington Post around the country, and independent out of England and other places, I realize this is not the flu, and is much worse than the flu, potentially, and you have to take this thing serious. So 4% mortality rate at this point. They saying worst case scenario in Iran could be 3.5 million dead. A lot smaller country than America. America is way behind the curve because of lack of testing. They don't know where it is. And also because of the culture of fear, mistrust, hatred, and all kind of divisions in America. They can't act like France. They can't act like Italy and Spain. And they can't act like Malaysia and lock the whole country down, because everybody already made a run on the gun stores and ammunition. What kind of stupidity is that in a health crisis? They running for guns and ammunition. But that's the spirit in America. That's the mindset among a lot of people, black and white. Everybody's scared to death. Think that the neighbors are coming to get your hoard of food and supplies. Other places, I don't think they think like that, or I don't think they react like that. But I know Americans think they're justified. Second Amendment, right to bear arms, believing that more than Jesus, and no matter what how many churches are going on, that's more to belief than Jesus. Okay, so that's a danger in America, and it's a problem. So San Francisco locked down, good. New York City mayor talked about locking New York down within 48 hours, good. Governor come out and overrode him, said he can't do it without his authorization, we're not going to do it, bad. Libraries closing, schools closing. It's left up to every individual locality, municipality, and institution in America to make decisions, which is not really good in a time of crisis. It needs to be a national leadership thing that says this is what we're going to do, and this is how we're going to do it, and this is why we're going to do it. But because of the paranoia in America, the fear, the hatred, the division, it can't happen. They'll say martial law, the population, black and white, and get all fearful, think it's a big conspiracy. They're coming to get our guns, they're coming to do this, they're going to make us take vaccinations, they're going to do this. So you can't do it because of the thinking of the people. Thank God people around the world are not on that trip and train. These are the reasons I'm saying I'm glad I'm in Malaysia, stuck. It's okay, and I'm really not stuck, but I'm staying here, and I feel safer, and I think I'd rather be here than in America. Here's the thing. If it's killing 4% worldwide now, and most Americans have not been tested, they're not going to be tested, they don't have the capacity, it's too late now, the cat's out the bag. Should have been doing this in January. They saw what was happening. The word was coming down through these international organizations like the World Health Organization, what this is, why it's a danger, and how we have to prepare. It was known by the top officials in every country. But Trump, our president, was in denial mode, lying and deceiving, trying to tell people nothing but a hoax, or Chinese something or another, it'll pass quickly. He was saying all these things, pathological liar, even though now he's saying he knew all along it was a pandemic before anybody else knew. But because they didn't act, it's too late really now to test everybody in terms of controlling it and containing it. Rather, it's not too late to act, but in terms of containment, that cat's out the bag. You contain when there's a few clusters, when you know where the clusters are, and you lock it down. It's too late for that. Now they're trying to do what they call blunt the curve, which is prevent too many people getting it at the same time and overrun the healthcare system. Now they're moving ships into place off the Gulf of Mexico, east and west coast, which is a good thing and a proper thing to do in case the healthcare system is overrun. They can move cases offshore, not virus cases, but other critical cases to make room. And I'm saying all that to say this. America ain't prepared. I'm in Malaysia, foreign country. I'm glad I'm here. I don't plan on leaving no time soon, and I'm glad the country's locked down, at least till March 31st, 2 weeks. And if it's not under control, then they may extend it, which I think they need to anyway, like San Francisco for at least 3 weeks. But at least the whole country's locked down to a degree, not just certain cities and agencies and municipalities and districts. Spreads over here, it's locked down over here, spreads over here, it's locked down over here. That ain't gonna get it. So I'm glad I'm here. I feel safer here. I feel better here. Another thing I'd like to share with you about the healthcare system here. Guy at the hotel that works here, he says for Malaysians, if you get sick, not from this flu, but for anything, you have to go to a government hospital or clinic, and they got a clinic right downstairs from me in this building. They closed up, all the resources being concentrated in the hospital in certain places. So he said you go to the clinic or the government hospital, it's 4 ringgit for a Malay to go. That includes consultation and medication. Now how much 4 ringgit is? It's 25 cents for a Malaysian to go to the hospital or the doctor. And you may be wanting to put them down, government hospital, all this, blah, blah, blah. Well, Truman in Kansas City is a government hospital. County hospitals in U.S. government hospital where the poor folks go. And even people with insurance go Grady Hospital in Atlanta. And they got all kind of hospitals in every major city where you don't have insurance, you can go, and even people with insurance go. Same way in Malaysia. To put it in perspective for you, I read a report, I can't remember the name of the magazine, I used to get it on my phone every month, put out by an American institution for expats who are living overseas or thinking about moving overseas, Americans. They give you a report on any country you're thinking about going to, so I ordered a report for Malaysia in 2018. And the segment of the report that talked about Malaysian healthcare said this: it's comparable to healthcare in the U.S. and in some areas it's superior. So when you think they're talking about government hospitals and not good healthcare, think again. Okay, for $10 a night, people would line up to get in Truman if they could, even with insurance, or Grady in Atlanta, or whatever that hospital is in Minnesota. I can't remember the name of it. So that's the situation here. Now for foreigners, you get sick, you need to go to the doctor, government hospital or clinic, 10 ringgit. That's, no, I'm sorry, 40 ringgit. That's $10. So if I go to a government hospital, I have to be kept $10 a day. I can afford that. For health care, dollars a day for consultation, for hospitalization, for medication, all wrapped up together. When I was in Thailand, the guy at the Airbnb manager, he told me it's just about free for Thai people. It's just about free for Malaysians too. Same way in Thailand. And I've been to the healthcare system in Thailand, to the county government hospital in 2018. Had a urinalysis and something else done. It cost me about $6, including the medication. And there's a beautiful brand new building in Pattaya I was in. And a lot of people, of course, but I was only there for about less than 2 hours with all those people. Organized. Okay, so the brother in Thailand, the Thai guy told me about it's free for Thai, but he said government hospital crowded, this and that. I got private insurance. He was proud to tell me that, and I understand. I said, well, how much? He said 400 and something baht, and I did the calculations in dollars. It's about a little less than $15 a month. His private health insurance. So Americans, black, white, brown, yellow, poor ones, when you mention health care for all, single payer, the first thing a lot of poor folks say is, who's going to pay for it? We can't afford it. Taxes going to go up. See, Americans don't know what's possible. Malaysia don't have the wealth that America has, neither does Thailand. But they're able to put a health care system in place where the citizens don't have to pay nothing. And they get covered for in-hospital, for out-hospital, for medication, for everything, without hardly paying a cent. But America, who likes to brag that we're a nation, we're the most powerful nation, the wealthiest nation in the history of the world, we can't afford it. And Americans buy into it because they don't know no better. All they know is what they know, what you've been programmed to understand from birth. You think your taxes are going to be too high, but can't afford it. And really, it's selfishness and greed. A lot of people don't want their neighbors to have what they have. Some people have insurance, and they don't really care about the ones that don't. And if they got good insurance, and you don't have good insurance, they really don't care. In fact, a lot of people don't want you to have what they have. Selfishness and greed. It's a mindset. It's a culture. But it's not a reality that you can't afford it because you can. If they can do it in Malaysia and Thailand, even in Ghana. I had health insurance in Ghana in 2013 through the national plan. Yes, government hospital. It's not nearly as good as it is in Malaysia and Thailand, but it's something. It beats nothing. I paid $13 a year. For children, it was $5 a year. But America can't afford it. And Americans believe it, buy into it, and repeat the same old foolishness. So, I'm here. I ain't going nowhere. I got food. The water comes into the building. It's filtered. They got machines down here. You put your cup under it like you do in the U.S. And, you know, like in public places, you can get water out of a machine at the doctor's office, dentist's office. That's the way it is here in the building. And it's free. And it's filtered and it's good. I don't have to buy water. Thought I would because, you know, but it's free. It's even cheaper than it was in Thailand. It's cheap, but here it's free. Where I'm at anyway. Food available here. Free bus to the train station, which I'm not going to. Because the place is locked down. They had a national talk from the Prime Minister yesterday that I couldn't understand. So I asked the guy here, what was he talking about? I need to know. It's about this virus. He said the main talk was for the population to take it serious, stay inside, other than when you have to go out, doctor or food or whatever, stay inside. Take this serious because it is serious. Guy who works here, whom I talk to a lot, I like, real nice. Now he's at home under lockdown because either he's got fever and sick or his wife does. And he went to that Muslim conference where that thing spread it, where it first started to spread. So if he's sick from it, not real sick, but they say the guy here said he's okay, he's doing all right. But I talked to him and I couldn't have it. Any of us can have it. You know, we touch door handles, we go and come. And I've probably been exposed. I've been on these trains with masses of people since I've been here. Probably been exposed, but so what? You know, most people that's exposed are not going to get sick, and the ones that get sick just be a little cold, lightweight flu, and they'll be okay. Here's the deal. I don't want to repeat myself, but I was making a point about the 4%. Some in the health agencies in America say that as many as 60% of the American population could get exposed to this before it's over because of the rapidity, how fast it spreads and how easy it spreads. If 60% get exposed, that's about 170 million people. It's 320 million in the U.S., 170, 180 million people. If the global mortality rate is 4%, say instead of 170 million Americans being exposed, only 100 million get exposed, 1/3 instead of 60%, 33%. Instead of a 4% mortality rate, say the mortality rate is only 1%. Now how many people that is dead at the end of the day? That's 1,100,000 Americans dead from this COVID-19 virus if those numbers hold up. And because America didn't move quickly and do the things that they should have done according to the World Health Organization, which is massive testing from the beginning to isolate the clusters, to know who to put under quarantine, and those kind of measures were not taken, still not being taken, this thing could spread through the population in America like a wildfire, like it's doing in Italy. They're getting 300 and 400 cases a day in Italy, and that's a lot smaller population than it is in America. So, I don't wish no bad on America. I'm not one of them kind of Negroes that's so-called conscious that praying for the doom and the downfall. It's coming anyway, but I don't pray for it because I got family, friends, and loved ones there. And I hope for the best. I don't want to see nobody get sick or die, including me. You know, but as for me, if it happens, it happens. I'm not scared to death about it. You know, if the worst came to worst, I'm ready to go. I don't plan on it. I don't think I am, but you don't know. You can't speed up your time of death, nor can you prolong it. But you have to use common sense and logic. I'm touching my face. I know it's hard not to, you know, but I keep my hands clean. That's the main thing. People talking about praying and get Jesus. Yeah, it's good to pray. It's good to call on Jesus. But it's also good to watch as well as pray. And after you get off your knees praying, do something logical or reasonable. Use your knowledge that you've gained to protect yourself. Don't just go and think Jesus is going to take care of it, because he ain't. whatever Jesus you believe in, you probably don't. Well, I won't go there. I'll leave that out of it. But anyway, do the things that they say. Keep your hands clean, hand sanitizer, stay away from crowds and people coughing and sneezing. Put a mask on. Don't be ashamed. Americans are ashamed to put a mask on. Here they don't have no shame. And I think it can be effective to a degree when you're in crowds. But hopefully you're not going to be in a crowd, because they are telling people 10 or more is a no-no when it shouldn't even be 10 people. And you keep your distance from people. Stay at home if you don't have to go to work. I don't have to go to work, thank God. It's bad for people who have to go to work, and even here, that don't have no money coming in. How you gonna eat? That's a terrible thing. Government has to step up and be responsible. Make sure people have enough food, shelter, and clothing. Food and shelter for real at this time. And most governments are being responsible. In Europe, they're putting a moratorium on mortgages and a lot of stuff. And they should do the same in America. They're talking about sending out checks, and that's not free money. That's money that you put into the system and your ancestors all your life. And in a critical time, they should send it out. It's good for the economy if you understand and you listen, you research. Poor people spend the money quickly, put it right back in. You give it to the rich people, they just stuff it and save it away, and it don't have much benefit. That's what happened in 2008, 2009. They paid each other bonuses. They got extra money at the top, and they didn't reinvest. So the economy took a long time to recover because the money went to the top. If it goes to the bottom, it's a better thing for the economy, plus it keeps people alive and healthy. Okay, I just want to share that. But being in Malaysia is not bad being here, really. And the government, I think, has done the right thing. Nationwide lockdown till March 31st, and it could extend it depending on how people respond and how effective it is. So I just want to share what it's like being in a foreign country. I'm glad I'm not in Ghana, to be honest. I'm not anti-black, anti-African, although I've learned a lot from being in Africa. The healthcare system ain't up to the challenge on a regular day. So I pray that this virus doesn't spread through Africa, because they're not in position to deal with massive cases in emergency rooms. Be a lot of dead folks in Africa, and I hope to God that doesn't happen. And the thing that they have going for them is that so far it spreads slower in heat and humidity than it does in cold climates. So hopefully that'll be some level and layer of protection for Africa. And if it gets to spreading there, just, for real pray. For real pray, because it won't be a whole lot. I don't know. They handled Ebola, so they'll be able to handle this too. So my prayers for them more than anybody. I'm glad I'm not there. Oh man, I got family and friends there, so I'm, you're on my mind and my heart. God bless, protect. Don't think this is a joke, because it ain't no joke. Some people think everything's conspiracy, everything's man-made, created. Nature has a way of fighting back. Disrespecting the earth, polluting the water, poisoning the soil and the air. You think this planet don't have intelligence? It does. You don't know spirituality. You just know church. You just know organized religion. You don't really know real spirituality. A lot of us don't. There is life abundant. This planet is alive. And it'll be alive once we're gone. We can kill it, we can destroy it to the point where we can't live here, which is what we're doing. And this may be Montezuma's revenge. And this ain't going to be the end of it. This could be just the beginning. We're doing things that's causing these kind of things. It don't have to be no conspiracy where the government unleash that. It's overall or disrespect of the environment and the planet. Okay. Hope this is helpful. Or even if it ain't helpful, hope it's insightful. Give you an idea what it's like being outside of America at this point. God bless, peace, and protection. Peace out.